Thank you. It's a real honor to be here today to talk with you. I don't have to tell anyone in this room that the 90% of children who live in low and middle income countries face a wide range of risks, from poor housing, dangerous neighborhoods, lack of sanitation, and high levels of maternal depression, as Atif discussed. And thinking about these risks as what's modifiable and what's protective, as Amina was mentioning, is really a critical part of thinking about how best to intervene for children. We developed a conceptual framework for this concept with the last Lancet series on early child development. You can see a timeline on the x-axis, and the green line represents the scenario where protective factors are outweighing risk factors. So this is optimal development for a child. The red line, in contrast, is where risk factors are outweighing protective factors. And my real area of interest, and also the interest of the Global Child Development Group, is thinking about how to reduce the risk factors, increase the protective factors through interventions during sensitive periods. Again, we're focusing on what are modifiable risk factors and what kind of interventions can modify those. So, in thinking about how to improve early child development, there's a huge range of possibilities. We have early nutrition and health programs which have shown success in iron deficiency, improving breastfeeding, improving complementary feeding, iodine supplementation. There's a whole range of health and nutrition interventions that work for children. We also know about parenting programs and family support. Parenting programs often target 0 to 2-year-olds, and in some cases, for example, in Pakistan, will use lady health workers, as Atif was describing. These programs work better for some. They're usually more effective for the most vulnerable populations. And they often can help promote better problem solving, better pre-literacy, encourage reading, and encourage play activities. Next, we have preschool programs, which are often focused on 3 to 6-year-olds. And these programs show that preschool attendance is, in general, associated with higher scores on many measures of child development. Now, we also know, though, that there's a wide range of quality differential across preschool programs, and that the higher quality programs do much better in terms of promoting child development. So what I'm going to talk about today are more of social sector approaches and other broader approaches. I'm going to focus really on conditional cash transfer programs, which is an area I've worked in, and I'll also give you some examples of infrastructure improvements and a living wage approach, and how those kinds of programs can affect child development. So you're probably all aware of how conditional cash transfer programs work. An unconditional cash transfer program is one that just provides cash to a household. And a conditional cash transfer program works when cash transfers are conditioned on a certain pre-specified action. And I'll show you what some of those actions are. Cash transfer programs invest. The idea is that they're investing in families so that those families can then make investments in human capital. And the requirements are that families will send children to school regularly, take them to health and nutrition checkups. And in these cases, mostly the cash is given to women. And the cash usually ranges from about 5 to 30%. So there are dozens of cash transfer programs now. And the very first ones that were developed were in Brazil and Mexico. So I'll just show you a conceptual framework of what cash transfer programs try and do. You may be aware of this graph showing the rate of return to investment in human capital, really emphasizing the fact that the earlier you invest, the bigger impact you can have. So cash transfer programs do try to get at many of the early interventions. There's a form of parenting support, there's early nutrition and health where needed, and continued nutrition and health interventions and schooling, and emphasis on schooling. In a recent review, we came up with a theoretic framework of how cash transfer programs could have effects on child development. So you might think about 2 major pathways. First is via the cash that the family gets. Again, this can be up to 30% increase in income for a household, so it's a substantial amount of income increase. You can imagine that this cash transfer could be used to increase parental investment in children through purchasing of basic needs, through investing in a child's future, support of schooling. You could also imagine that the cash could be a way of decreasing emotional support and depression. So I will show you some evidence that the cash transfer programs often are associated with decreases in depression, and this can then allow a mother or a parent, a caregiver, to more sensitively and responsively focus on caregiving. Along the bottom pathway, you see the conditions. So this is the part that, I'm in a school of public health. This is the part public health people get excited about. The mandatory participation in health and education services, the direct provision of medical care, prenatal care, vaccinations. And this part down here, the box on the bottom about education for parents, this is the idea of bringing parents into the equation and having them have responsibility to obtain that education. So I want to also make a point about the quality and delivery of health and education services. There's a wide range of quality of programs. This is because not every country that implements a cash transfer program has the infrastructure to be able to sustain it, maintain it, and deliver it. So I want to say that part of the reason that you'll see heterogeneous results across programs is that there's a large amount of heterogeneity in terms of what the programs look like and what the infrastructure looks like. So we have seen, I'm giving you the meta picture here about the inconsistent effects of cash transfer programs on children, and then I'll describe the Mexico program. So in this review, we found that there were generally positive effects on birth weight, illness, behavioral development, prenatal care, maternal depression, growth monitoring, so several of the pathways that I discussed. So in these generally positive effects in this review of about 20 different cash transfer programs were encouraging. But what wasn't as encouraging were these mixed or subgroup effects on height, weight, and cognitive and language development, which is the area I'm really interested in, and in the terms of the presence of skilled birth attendants. And we did not find consistent effects at all on the terms of the effect on hemoglobin concentration. I'm not going to talk now about the differences between unconditional and conditional cash transfer programs, but I'm happy to address that in the discussion. It's a very interesting and relevant question at the moment. So why are there these inconsistent effects? Well, I mentioned that there are radically different cash amounts based on what country you're in and what program you're exposed to. There are different requirements. Some programs have health requirements, others have all the way through high school schooling requirements. There are also obvious differences in initial levels of poverty and different rates of compliance. So this is why there could be inconsistent effects. And some meta-analyses have tried to take apart these different programs and look at what variables it could be that is explaining what the difference is. But it's been difficult because a conditional cash transfer program in particular is just this giant black box of a program that's very hard to disentangle what's actually going on. So Mexico's cash transfer program, just to give you an example, this was the second one that was put in place after Brazil. So children and adolescents, this is again part of the requirement for receiving the 25 to 30% increase in cash, the unconditional cash. Again, a conditional cash transfer program means that there's conditions which are required for the receipt of the cash, but the cash can be spent in any way that the family chooses to. There are no conditions on spending the cash. You just want to make that clear. So you can see there are checkups for children throughout childhood. There are checkups and requirements for pregnant and lactating women, and there are some checkups for adults, but really there's not a lot of investment in adult outcomes, and that will come back later. So I'm briefly going to tell you about the 10-year follow-up that we conducted in this randomized controlled trial. You can see here the design of the two randomized group, early and late, and I'm going to tell you again about the 10-year follow-up. We did find that the two groups, the ones that were able to be followed and the ones that were not followed up, were well matched. And we also found that the randomization that had occurred 10 years earlier was true. At 10 years after the baseline, the groups were still not different on any of the dimensions that we measured. The program effects on height and behavior were the most significant. So we found a decrease in behavior problems in those children who were exposed to the program, to the cash transfer program, the conditional cash transfer program. We did not find effects on body mass index, on verbal performance, IQ, or cognitive measures of this IQ scale, but we did find effects on height for age, Z-score, in the sub-sample of children with mothers with no education, which represented about 25 to 30% of the population as a whole. So these results were encouraging in terms of the effects on the most vulnerable kids and on the behavior problems. But we asked ourselves the question of why the program didn't have as much of an effect as we thought it would. So then that led us to doing an analysis where we tried to separate out the cash transfer effect from the conditionality effect, essentially trying to say, we understand this is a post hoc analysis, and this is a black box analysis. This is trying to open up the black box and see which part of the program is functioning and how. So what we found is that when we separated out the cash effect, we found that cash transfers, cumulative cash transfers, were associated with improvements in growth, improvements in verbal performance, improvements in cognitive performance, and a decrease in behavior problems. So across most of the measures that we collected, we saw that the cash, while controlling for the conditionalities in the form that all of these children had been enrolled in the program for their entire lives, had this independent effect. And this was very exciting, and thinking about the cash effect is separate and apart from the conditionalities. We also found that there's reductions in depressive symptoms that resulted from participation in the conditional cash transfer program. And again, as both of my co-panelists have alluded to, alleviating poverty is a way that this is suggesting that alleviating poverty is a way of addressing maternal depressive symptoms. We found a 2-point difference on the CESD, which is a depression screener, and we found 7 percentage point difference when we looked at the prevalence of high depressive symptoms versus low. So I wanted to also show you results relating to child cortisol. Salivary cortisol is a way of measuring child stress. We found that the participation in the program also reduced child stress levels, and this was significant. This effect was really driven by children of mothers with high depressive symptoms, suggesting that these children of depressive mothers are more sensitive to context, or that non-depressed mothers are better able to provide buffers for their children and protecting them from poverty. So what, in summary, we found was that there was a program effect that really influenced behavior, child behavior, and height for age in a vulnerable population, and also the program effect on salivary cortisol and on depressive symptoms. And we found this cash effect that was significant, and I didn't show you the previous paper which showed the 3 to 5-year-old, the effects in the 3 to 5-year-olds. But both of those papers showed consistently the effects on improvements on stunting, cognitive and language function tests. We showed BMI earlier, and then behavior problems. But I want to point out that cash transfer programs are not a panacea, and I certainly don't want to go on the record as saying that they're the only way to improve child development, as you've seen many other ways to think about improvements in terms of child outcomes. We also did 2 analyses showing that in terms of effects on adults, that you see a very small program effect, but that when you portion out the cash effect, you actually see that increased cash going to the household is associated with increased BMI, increased obesity, and increased hypertension in adults. So this is a real conundrum for policymakers to think about. If our goal is to improve child development, do we focus on that and not worry as much about the adults, or do we refocus the program in terms of thinking about obesity in adults? I should mention that Mexico has the 2nd highest prevalence of obesity in the world after the United States. Something like 60 or 70% of women in Mexico are overweight or obese. So it's a really relevant policy question for a country like Mexico that's going through the nutrition transition. The only explanation I have, we've done some analyses showing that increased cash in these households is often associated with purchasing of soda and purchasing of alcohol. So that's one potential pathway, that it's possible that parents are making better decisions for their children than they are for themselves, because that cash is working positively for children and not for adults. Now, I'm going to quickly tell you about another addition to a conditional cash transfer program that I'm really excited about. So this is kind of like hot off the press data that I want to tell you about, that is looking at overlaying a parenting program on conditional cash transfer. So for example, I have been disappointed in terms of the effect of the program itself on looking at poverty alleviation and health inputs as the only way to improve child outcomes. So the idea here is to say, let's see what we can do by putting a child stimulation program, a group parenting support program on top of a conditional cash transfer program. Now, this parenting support could be improving outcomes for kids through depression. It could be improving outcomes for children, as in the conceptual framework that Amina presented, through social support and also through increased quality of care and cognitive stimulation. I would love to show you a video of what this program looks like, but it's already got the orange buzzer, so I'm gonna keep moving, and I'm gonna show you that we are finding that this group that perceived that they had to participate in parenting support had much better cognitive outcomes in children. So this is a randomized controlled trial where overlaid on a CCT, which said this group, the part of the CCT is attending parenting support. This group, part of the CCT, there's no requirement, but we think you should attend. It's a voluntary. That's the voluntary group, and then the control group, which just had the CCT. So this was encouraging to see that this compulsory group had the best performance, but also raises the question, again, of how do you make something compulsory without being paternalistic about what you think might be best for somebody's child. I'll mention that we had the biggest effects for most vulnerable children. So the kids who started out at baseline with the lowest cognitive scores really performed the best 2 years later when we followed them up. And so clearly there's a way that they're benefiting, and it's really similar in terms of effect to the stunting reduction that we showed just in the children who were the children of mothers with low education. Okay, so I'm going to give you some conclusions, show you just 2 slides on these interesting and novel other kinds of interventions, and then I'll wrap up. So this Educación Inicial overlay on the conditional cash transfer showed small, significant main effects with significant, consistent positive effects for very vulnerable children. In spite of the positive results, it really could be strengthened for a greater impact on child development. And I think that's going to be one of my larger conclusions, which is that if you really want to focus on early child development, reducing poverty is not getting you as far as you want to go. There also needs to be a critical component of child stimulation through parenting support or simply through education for parents about how to provide that stimulation. So I'm going to tell you about these 2 interesting studies, which are, again, represent kind of not thinking about direct interventions on children, but representing thinking about the environment. This was a study, a large-scale Mexican program that replaced dirt floors with cement ones, and showed significant, in a random approach, and showed significant reductions in maternal depression, equivalent to what we found in the conditional cash transfer program, and also showed significant effects on growth and child development. So the explanation for how this could be is that it's possible that there's the mental health component, and also that if you have a cement floor, you're more likely to put your child down and let that child explore the environment than you might be more likely to hold on to that child in a dirt situation. So that's one kind of out of the box thinking about how to improve child development in a way that's not directly about it. And then this study that I'm currently conducting in the Dominican Republic, in which one group, this would be your lucky day if you were in this group, got told after they were hired that their wages were going to be 300% of what the neighboring wage was, because you were part of a study that was looking at the effect of living wage on outcomes in the Dominican Republic. Yeah, right? So they're pretty psyched. So we did a 1-year follow-up with these children, with the mothers, and found a 5 points effect on the CESD, a 5-point effect out of a scale of 60. These were results that I kept having to go back to. Are we sure this is right? Let's redo the analysis. Let's make sure that we redo it in every way possible, because it's such a big effect size. But then when you think about that, it's a 3x increase in terms of wage, that it is a plausible effect. So we're in the process of looking at the children of these women. And also, I'm going to just end with a few quotes describing the benefits of the living wage, just thinking about that, kind of put into context the effects of poverty on development. With a living wage, I don't lose sleep anymore as a mother wondering how I will make ends meet. I would say this program is the salvation for a lot of mothers. And then secondly, to live a dignified life means to have a bathroom inside. It means being able to eat 3 times a day. It means being able to get an education and being able to get your children an education. A not dignified life is not having a future. So to finish, I just will say that we know that children in low and middle income countries are not performing at their potential because they're exposed to this wide range of risks, including maternal depression and including poverty. And these broader approaches that I've talked about today offer one type of solution, this conditional cash transfer, promotion of living wage. I didn't talk about microcredit, but that's another approach that's kind of outside of thinking of direct approaches for children. But I would say the large caveat in thinking about these programs is that for these to be most effective in terms of improving child outcomes, particularly thinking about school readiness and learning outcomes and early child development, they need to be paired with a direct promotion of early child development in some form of cognitive or language stimulation. It's been beeping for a while. I apologize for going over. Thank you.